Hello everyone, hope all of you fine and doing well. I'm Dr. Yaldona Zari, second master student of Al-Farabi University. Today presentation is about endocrine system, hormones and their action, and endocrine disorders. The contents or the topics that I will explain you in this presentation. First is about cause of hormone hyposecretion and hormone hypersecretion, common disorder of pituitary gland, thyroid gland, parathyroid gland, and adrenal function. And at the end, I will explain you about cause and pathology of diabetes mellitus. What is endocrine gland? At first, I want to introduce very short about endocrine glands. Endocrine glands release or secrete hormones into the bloodstream, and the endocrine glands include adrenal gland, hypothalamus gland, parathyroid, thyroid, pineal, pituitary, and ovaries gland. And if the secretion of hormone from these glands are too much, or the secretion is not enough, this can create several diseases that causes every part of the body. Endocrine system disorder. Diseases of endocrine system are relatively common, and endocrine disease usually involve the secretion of too much or not enough hormones. As I said, if the secretion of hormone is too much, it's called hypersecretion, and if the secretion of hormone are not enough, it's called hyposecretion. Variation in hormone can affect on every part of the body, and at first I want to explain you the cause of hyposecretion. Hyposecretions mean inadequate hormone release. In this case, the gland that secrete group, it destroys because of annihilation or because of honey tumor. The best example of hyposecretion is type 1 diabetes. In this case, the body's own immune system attacks and destroys cells of the pancreas that secrete insulin, and it making type 1 diabetes and autoimmune disease. A person with type 1 diabetes must frequently monitor the level of glucose in the blood, and if the level of glucose is too high, insulin is injected to bring it under control, and if it is too low, a small amount of sugar is consumed. Another endocrine disorder is hypersecretion. Hypersecretions, here the main cause is a tumor. For example, tumor of pituitary glands. It causes to secrete growth hormone, and if this occurs in childhood, it results in very long arm and leg, and abnormal tall stature by adulthood, and this condition called gigantism. Pituitary gland is a tiny organ. It located at the basis of the brain. It also called the master gland of the body. It produces many hormones that travel throughout the body. The hormones that made in the anterior part of the pituitary gland are including thyroid stimulating hormone, ECTH, or adrenocorticotropic hormone, growth hormone, prolactin, luteinizing hormone, or we can say LH, FSH, or follicle stimulating hormone. And two hormone are secreted from the posterior part of pituitary gland, and they are including oxytocin and antidiuretic hormone, or EDH. Pituitary disorder. There is some disorder that I will explain to you in the next slides. The first disorder that is caused because of hormone disorder is called acromegaly, and it is because of oil secretion of growth hormone. It is if the secretion of growth hormone is high, it's a situation that occurs is gigantism, and dwarfism is another disorder. It occurs when there is hyposecretion of growth hormone. Acromegaly has, I said previous, that it is created because of high amounts of human growth hormone from pituitary, and most common cause is a benign tumor in the pituitary. It is usually develops in adults between the age of 30 and 50, but the symptoms of acromegaly can appear at any age. If it develops before you have stopped growing, which usually occurs between the age of 15 to 70, it can cause gigantism. What is the symptom of acromegaly? Some symptom of acromegaly are including the swelling of the hands and feet, and also tiredness and sleep disturbance. Other symptoms are rapid growth in height, significantly enlarged hands and feet, change in appearance of face, headaches. Also, these patients has visual problems. They can also lead to heart disease, respiratory disease, arthritis, or diabetes. Other symptoms are enlargement of lip, nose, and tongue, depending of the voice due to enlarged vocal cords and cyanosis, thicker, coarse, or oily skin. These patients has joint hitches, excessive sweating and skin odor, skin tags, tiny flesh, collar finger like a projection on the skin. Other symptoms are loose or lack of libido, and it can see in the both women and men, erectile dysfunction in men. Also, in women, they will have menstrual disorder, for example, amenorrhea, or they will have breast discharge also. Fatigue and weakness is other symptoms, and also sleep apnea, breaks in breathing during sleep due to obstruction of the airway. In this picture, you see that there is some symptoms of a patient who has acromegaly. You can see large tongue, nose, tall leg, and also see some changes in the hands of the patient. What is craniopharyngioma? Craniopharyngioma is another pituitary disorder. It is very rare, and the cause of this disorder is a benign tumor. It is non-cancerous. It occurs in 50% and children between 16 years old, and the other case or can occur at any time in adult life. This type of tumor are cystic mass, and it is very rare, and it is congenital. It has two types: faster growing craniopharyngioma and slow growing. The faster growing affect children, and the slower growing affects adults. This type of tumor can cause headache, can cause visual problem, and also it can affect anger, thirst, and sleep patterns. What is the typical symptom of craniopharyngioma? The typical symptom of craniopharyngioma are headaches, and sometimes it can be with nausea and vomiting, diabetes insipidus, disturbed sleep pattern, vision disturbance, behavior change, including introversion and inability to concentrate, and slow growth. Other symptoms are increased sensitivity to cold or heat, early or delayed puberty in children, irregular period or loss of normal menstrual function in adult females, and these patients will have amenorrhea, impotence in adult males, reduced fertility in adults, decrease in sex drive adults, also tiredness and in some patients they feel appetite and weight variation. What is Cushing disease? Cushing disease is another disorder of pituitary. Cushing disease syndrome develops if the body makes too much cortisol hormone. And the other common cause of Cushing disease is glucocorticoid treatment. For example, taking a steroid such as prednisolone for patients who has asthma or has arthritis or colitis. This can cause this disease. More women, it affects more women than men, and but it is not known why. It is most commonly diagnosed between the age of 30 to 40, and it is very rare in children. There is not any environmental factor, and Cushing disease is not hereditary. What is the symptom of Cushing disease? The symptom is very varied, but the most common symptom is excessive and sudden weight gain, especially on the back of neck, or we can say in the trunk, and the arms and legs maintain and change, and this may cause a very some other changes in the body. This patient has also weak muscles, especially in legs. A very classic sign of Cushing disease is moon face. It means the face tends to be rounder and redder than normal. This patient may have develop acne, and also the bones may have become weaker, and X-ray may show a fracture rib for NS tense, and it is maybe due to the steroid osteoporosis. In this picture, you can see the moon face that is shown in this patient, and also you can see the weight gain in trunk, the arm and leg of this patient. You see that it is very thin, and there is not and also here is you can see the stereo. It is shows like the pregnancy stereo. Other symptoms are blood pressure may be higher than normal. The patient may have developed diabetes mellitus. Some people may also notice a tendency to bruise easily and have deeper red or purple stretch marker stereo appearing on the abdomen, as I show you in the picture. Some women experience irregular period, stop having them altogether, and excessive hair growth, especially in the face of the woman. Men can experience decreased fertility. Both men and women can feel reduction or absent of sex drive, or we can say they may have libido, feeling generally unwell and more susceptible to infections. They have mood swings such as being more irritable, feeling depression and anxiety. In children, it may show itself by growth stopping and weight increasing. At the end, we can say that Cushing's affect many parts of the body, both mentally and physically, and affects different people in different ways. Thyroid gland disorder. Thyroid is another gland, and it can create some disease. Several different disorders can arise when your thyroid produce too much hormone, or not produce enough hormone. There are four common disorders of the thyroid glands. The first one is Hashimoto's thyroiditis, the second one is Graves' disease, the third one is gout, and the fourth one is thyroid nodules. And now I will explain you in next slides every type of thyroid disorders. What is hyperthyroidism? Hyperthyroidism, it means that the thyroid gland produces too much of its hormone. In hyperthyroidism, the thyroid gland is overactive, and hyperthyroidism affects about 1% of women, and it's less common in men. What is the cause of hyperthyroidism? The main cause of hyperthyroidism is Graves' disease, and it affects about 70% of people with an overactive thyroid. Another cause of hyperthyroidism is nodules on the thyroid. It is a condition that called toxic nodular gout or multinodular gout, and it can cause the gland to overactive and to overproduce its hormone. What is the symptom of hyperthyroidism? These patients are mostly have restlessness, nervousness, racing heart, irritability. They have increasing sweating, shaking, anxiety, also trouble sleeping, thin skin, brittle hair and nails, muscle weakness, weight loss, and they may have bulging eyes. That it is very specific in Graves' disease, and you can see in this picture. Also, this is another sign of hyperthyroidism, tiny eye and nails. Hypothyroidism is the opposite of hyperthyroidism, and the thyroid gland is underactive, and it can produce enough of its hormone. There are two types of hypothyroidism: congenital hypothyroidism and adult hypothyroidism. Congenital hypothyroidism is seen in infants, and the infant suffers abnormal bone development, thickened facial feature, they have low temperature, they have lethargy, brain damage, and cretinism can see in children. And adult hypothyroidism is also called myxedema. These patients have low metabolism rate, sluggishness, sleepiness, weight gain, constipation, dry skin, and dry hair, cold sensitivity, and also they has high blood pressure and tissue swelling. What is the cause of hypothyroidism? Hypothyroidism is often caused by Hashimoto's thyroiditis, and also surgery or remove of the gland can cause hypothyroidism, and also damage of the gland because of radiation treatment can cause hypothyroidism. And most cases of hypothyroidism are mild. What is the symptom of hypothyroidism? The common symptoms are including fatigue, dry skin, increased sensitivity to cold, memory problem, constipation, depression, weight gain, weakness, slow heart rate, and coma is the end stage of the hypothyroidism. This is a picture that shows you the cretinism, that is a congenital hypothyroidism, some changes in the mind, in the leg of the patients, and this picture shows you myxedema. It shows you the dry skin, and this is a patient who has hypothyroidism, and it occurred in adult patient. What is Hashimoto's disease? Hashimoto's thyroiditis is also known as a chronic lymphocytic thyroiditis, and it is the most common cause of hypothyroiditis. It can occur at any age, and it is most common in the middle age of women. This disease occurs when the body's immune system mistakenly attacks and slowly destroys the thyroid glands, and destroys its ability to produce hormone. What is the sign and symptom of Hashimoto's thyroiditis? As I said, that this is the main cause of hypothyroidism. So the symptoms of Hashimoto's thyroiditis is similar to hypothyroidism, and they are including fatigue, depression, constipation, mild weight gain, dry skin, dry and thinning hair, a pale and puffy face, EV and irregular menstruation, and also they have intolerance to cold and enlarged thyroid, or they have gout. Another thyroid disorder is Graves' disease. Graves' disease is an autoimmune disorder, and the body makes antibodies to thyroid stimulating hormone receptor, and resulting in absence of negative feedback and hyperthyroidism. The main symptom of this disease is bulging here, and you can see in this picture. Gout is another thyroid disorder. It is a non-cancerous enlargement of the thyroid gland. The main cause of gout is iodine deficiency in the diet, and it can affect anyone at any age. Especially, it affects those people who are living in the areas that there is the lack of iodine in their foods, and also more common after the age of 40, and it is common in women. Other risk factors are including the family medical history, certain medication usage, pregnancy, and radiation exposure. What is the symptom of gout? The symptom of gout isn't severe. It depends on the size of mass, and these are including the swelling or tightness in neck, difficulties breathing or swallowing, cough or wheezing, and hoarseness of voice. This is a picture that shows a very large mass in the neck of this person, and the main cause is iodine deficiency. Thyroid nodules is another thyroid disorders. It form in the thyroid nodules are growths that form on or in the thyroid gland. It about 1% of men and 5% of women living in highly insufficient countries having thyroid nodules that are large enough to feel, and about 50% of people will have nodules, and they are it is very small and that are too teeny to feel. Problems nodules are more common in women than men, and the risk in both sex increase with age. What is the cause of thyroid nodules? The causes are not always known, but it can include iodine deficiency, Hashimoto's thyroiditis, and the nodules can be solid or fluid filled. Most are benign, but they can also be cancerous in a small percentage of cases. What is the symptom? Some nodules produce thyroid hormones and causing abnormal oil levels in the bloodstream. And when this happens, symptoms are similar to those of patients who have hyperthyroidism, and it can include high pulse rate, nervousness, increased appetite, tremors, weight loss, and clammy skin. Another gland is parathyroid gland. Parathyroid disease affects the parathyroid hormone. The gland produce parathyroid hormone, and parathyroid hormone help maintain the correct balance of calcium in the body. Normally, the glands release just enough parathyroid hormone to keep calcium levels normal, and disease upsets this delicate balance. There are three types of parathyroid disease, and the first one is hyperthyroidism, parathyroidism, parathyroid cancer, and hypoparathyroidism. Uh, what is hypoparathyroidism? Hypoparathyroidism means that the body does not make enough parathyroid hormone, and it results the level of calcium in the body is too low, and the condition called hypocalcemia. And this condition caused because of surgical excision or damage of the parathyroid, and it can also happen from the autoimmune attacks on the gland. Another parathyroid disorder is hyperparathyroid. Hyperparathyroid is another disorder that it is the most common type of parathyroid disease. In parathyroid, in hyperparathyroid, the tumors create more parathyroid hormone, and it results that the gland make too much calcium, and the condition create it's called hypercalcemia. Hypercalcemia can cause serious problems including osteoporosis, kidney stones, heart disease, high blood pressure, and most people with primary hyperparathyroidism have no symptom, but some people experience mild symptoms such as muscle weakness, fatigue, increased need for sleep, depression, itches, and pains in the joints of the bones. And other symptoms are including the loss of appetite, nausea, vomiting, constipation, confusion or impaired thinking and memory, and increased thirst and urination. Hypoparathyroidism increase the risk of Addison disease. Also, cataract is another symptom that create because of hypoparathyroidism. Parkinson disease and pernicious anemia. Addison disease is a disorder when the adrenal glands don't make enough hormones, and this risk is associated with autoimmune, and it is related to hypoparathyroidism. And also Parkinson disease is a progressive disorder that affects the brain and causes abnormal motivation. And pernicious anemia is created because of lower of vitamin B12. This risk is associated only with autoimmune related to hyperparathyroidism. Okay, adrenal disorder. Adrenal disorder is another gland disorder, and Cushing syndrome is one of the adrenal disorder. It is it created because of excess or too much of cortical secretion, and it causes hyperglycemia, hypertension, and weakness and edema. Muscle and bone loss occurs with protein catabolism, and this patient has puffy face, or we can say moon face. And also another adrenal disorder is adrenogenital syndrome. Adrenogenital syndrome, adrenal androgen hypersecretion accompanies Cushing syndrome, causes enlargement of external sexual organs in children and early onset of puberty, and masculizing effects on women, and it can cause a deeper voice and birth growth. Another is Addison disease. Addison disease is a very rare disease, and it develops when the adrenal glands do not make enough cortisol. In most cases, Addison disease, the body also doesn't make enough of the hormone aldosterone. Addison disease is an autoimmune disease, a condition which immune system which is supposed to protect the body, and it mistakenly attacks the body one tissue and cells. In the case of Addison disease, this reaction results in damage to the adrenal gland. And also the symptoms that these patients has, they are fatigue, weakness in muscles, loss of appetite, weight loss, blood pressure is low, and also they feel irritability and depression. Another disease is Addison crisis, and it caused because of increase in stress. And this is the same picture that shows in Addison disease. Another topic is about the diabetes mellitus. Diabetes mellitus, as I say that it is a syndrome with disorder metabolism, and the cause is the main cause is the insulin resistance or deficiency of insulin, or we can say it is the combination of insulin resistance and inadequate insulin secretion to compensate. There are some symptoms of diabetes mellitus. There are three common symptoms: frequent urination, increased thirst, and increased appetite. Types of diabetes mellitus. There are two types of diabetes mellitus: type 1 and type 2. Type 1 results from the pancreas failure to produce enough insulin due to loss of beta cells, and this form was previously referred to insulin dependent diabetes mellitus, or IDDM, we can say. And the loss of beta cells is caused by an autoimmune response, and the cause of this autoimmune response is still unknown. This type of diabetes mellitus is occur in just 10% of people, and there is a low secretion of insulin, and it diagnosis in the children and young people, mostly diagnosed about age 12. How we can treat this type of diabetes? Treatment of these patients are including the diet, exercise, monitoring of blood glucose, and periodic injection of insulin or insulin pump. And type 2 diabetes begins with insulin resistance, a condition in which cell fail to respond to insulin properly. It means that the cells does not respond to insulin. As the disease progress, a lack of insulin may also develop. This kind of or type of diabetes mellitus occur in 50% of the people. It's also known as a non-independent diabetes mellitus. And in this type, the most common cause is combination of excessive body weight and insufficient exercise. Or we can treat this type of diabetes. Treatments are including the weight loss program of diet, exercise, and they will use oral medication to improve insulin secretion or target cells sensitivity. What is the pathology of diabetes? As you know that insulin is the principal hormone that regulates the uptake of glucose from the blood into most cells of the body, especially in liver, adipose tissue, and muscles. And therefore, deficiency of insulin or the insensitivity of its receptor play a central role in all forms of diabetes mellitus. The body obtains glucose from three main sources, and the first sources intestinal absorption of food. The second is the breakdown of glycogen or glycogenolysis, and the third one is the storage form of glucose found in the liver, and gluconeogenesis, the generation of glucose from non-carbohydrate substrates in the body. Insulin plays a critical role in regulation glucose levels in the body, and also it can inhibit the breakdown of glycogen or the process of glyconeogenesis. It can stimulate the transport of glucose into fat and muscles cells, and also insulin can stimulate the storage of glucose in the form of glycogen. Insulin is released into the body by beta cells, and it found in the highlights of Langerhans in the pancreas, and in the response to rising level of blood glucose, typically after eating, insulin is used by about two-thirds of the body cells to absorb glucose from the blood, and use it in the for example in the conversation and into other needed molecule or for storage. And lower glucose level result in decreased insulin, and it can cause to release not enough insulin in the body, and this process is mainly controlled by the hormone glycogen, which acts in the opposite manner to insulin. If the amount of insulin available is insufficient, or if the cells respond poorly to the effects of insulin, there is create a condition that called insulin resistance. And if the insulin itself is defective, then glucose is not absorbed properly by the body cells, and that require it, and is not stored appropriately in the liver and muscles. The net effect is persistently high levels of blood glucose, poor protein synthesis, and other metabolic derangements such as metabolic acidosis in cases of complex insulin deficiency. When glucose concentration in the blood remains high over time, the kidneys reach at threshold of reabsorption, and this increases the osmotic pressure of the urine and inhibits reabsorption of water by the kidney, and also it resulting in increased urine production, and it causes polyuria and increase fluid loss. Lost blood volume is replaced osmotically from water in body cells and other body compartments, and it causing dehydration and increased thirst or polydipsia. In addition, intracellular glucose deficiency stimulates appetite and leading to excessive food intake or polyphagia. So these are the pathology of diabetes that can cause polydipsia, polyphagia, and polyuria. Okay, thank you for your attention. If you have any question, you can put a comment on the in the box, and I will answer your question.